Hello students, today we will be discussing on hydrocephalus. Hydrocephalus is a neurological disorder that occurs when cerebrospinal fluid, that is CSF, builds up in the brain ventricle or hollow space, which causes the ventricles to widen, putting pressure on the brain's tissues. The clear, colorless fluid called cerebrospinal fluid surrounds and supports the brain and spinal cord. The body normally generates and absorbs the same quantity of CSF daily, but when excessive amount of CSF accumulates, it can impair brain function, result in brain damage, or could be fatal. Let's first dive into the cause of hydrocephalus. The increasing fluid can be due to obstruction, poor absorption, or overproduction of CSF. Such a blockage impairs the fluid pathway, particularly within the narrow passages connecting the ventricles. Additionally, problems with the body's ability to absorb CSF can lead to its accumulation. This may result from the conditions such as meningitis, bleeding in the brain, or tumors. Rarely, excessive CSF production can contribute to hydrocephalus. This impaired CSF flow or absorption can develop from a number of risk factors, including developmental abnormalities like neural tube defect, genetic factors, intrauterine infections, intraventricular hemorrhage, traumatic brain injury, subarachnoid hemorrhage, medical procedures, and infections like meningitis. Hydrocephalus can be categorized into communicating or non-obstructive hydrocephalus and obstructive or non-communicating hydrocephalus based on its causes and characteristics. Now, let's consider the symptoms. Hydrocephalus tends to manifest differently depending on age. In infants, one might notice bulging frontanel, extreme fussiness, downward deviation of eyes known as sunsetting eyes, excessive sleepiness, poor feeding, and low muscle tone and strength. In toddler and older children, however, symptoms like short, high-pitched cries, changes in facial structure, crossed eyes, headache and muscle spasm, increased head circumference, and trouble staying awake or waking up become pronounced, accompanied by difficulty in walking. Diagnosis usually involves neuroimaging techniques such as CT scan or an MRI. This test helps visualize the excess fluid, allowing doctors to determine its cause and extent. Additionally, lumbar puncture, genetic testing, neurological assessment, and intracranial pressure monitoring can help in diagnosis of hydrocephalus. The mainstay in treatment is the surgical placement of a shunt, a device that redirects excess fluid from the brain to another part of the body where it can be absorbed. Another procedure used is called an endoscopic third ventriculostomy. In this, a hole is created in the ventricle to facilitate CSF flow. Likewise, endoscopic cold plexus cauterization, medication, and physical therapy can be used as a treatment modalities. If there is a concern about the possibility of hydrocephalus, it can be prevented by prenatal care, vaccination, preventing head injuries, having genetic counseling, treating underlying conditions, and maintaining healthy lifestyle in case of younger and older children. To sum it up, hydrocephalus is a condition marked by excessive CSF in the brain ventricle caused by obstruction, poor absorption, or overproduction of CSF. Symptoms vary by the age, with infants showing rapid head growth and youngers experiencing headache and difficulty in waking up. Diagnosis involves neuroimaging, while treatment typically include surgical shunt placement or endoscopic procedures. With proper care, many individuals can lead healthy lives. Thank you for listening.